Patient Protection and Affordable Care Act, also known as the Affordable Care Act or Obamacare, was signed by our President Barack Obama on March 23, 2010. This is the new healthcare reform law. It is made up of the Affordable Health Care for Americans Act, the Patient Protections Act, and the healthcare-related sections of the Healthcare Education Reconciliation Act and the Student Aid and Fiscal Responsibility Act. The goals of the Affordable Care Act are to provide more Americans with affordable, quality health insurance and to curb growth in healthcare spending in the U.S. and to basically put the consumers back in charge of their health care. The Affordable Care Act includes new benefits, rights and protections, rules for the insurance companies, taxes, tax breaks, funding and spending, and the creation of committees, education, and new jobs.
Who are the newly covered? The uninsured. Rural residents. Adult children up to age 26 can stay on their parents' health insurance. Privately insured. Children and adults with pre-existing conditions cannot be excluded from having health insurance. How will coverage be achieved? States can expand their Medicare program to people who are below the federal poverty level. The creation of affordable health insurance marketplace. Individuals at certain federal poverty level may be eligible for a subsidy. Preventive care, women's health, and wellness programs will be expanded at a low cost or no cost to the consumer, providing tax breaks to small businesses for offering health insurance to their employees, making children's health insurance program easier for kids to get, and improving Medicare for seniors.
What are healthcare insurance exchanges? The ACA Health Insurance Exchange are online marketplaces for health insurance. Americans can use their state's affordable insurance exchange to obtain coverage from competing private health care providers. Shoppers can use a price calculator to see if they qualify for cost-assisted subsidies as well as Medicaid and CHIP, and see side-by-side comparisons of qualified health plans ensuring the best deal for them and their family. Each state has their own marketplace, but currently only 15, and including DC, have theirs set up. If applying from other states, you can enroll at healthcare.gov. You can access District of Columbia's official marketplace through the website DC HealthLink. You can only apply during open enrollment, which is from November 15th through February 15th. You can apply for coverage, compare plans, enroll, and automatically calculate if you apply for these tax credits and cost assistance. When applying, you need the following information: last year's tax information, social security number or legal documentation, medical history, employer and income information for every member of your household who needs coverage, for example, pay stubs or W-2s, and any other information that could affect your health insurance premium. Like DC, Maryland's official website is the Maryland Health Connection. They have the same enrollment period and operate in the same manner as DC, as well as the other states that have their own websites. Plans come in 4 tiers: bronze, silver, gold, and platinum. Bronze is a split cover expenses of 60-40 on average. With the bronze plan, 60% is covered by the insurer for health expenses, while the policyholder must come up with the other 40%. This is the cheapest plan, with is usually not more than 8% of your income. Silver has a split cover expenses of 70-30 on average. Silver is considered standard and cannot be more than 9.5% of your income. This is the only plan that are eligible for cost sharing reductions. Gold has a split cover expense of 80-20 on average. Gold is for people who don't qualify for cost sharing deductions but need low deductibles. Platinum is split cover expenses of 90-10 on average. Platinum has the highest monthly premiums but lower out-of-pocket costs. This plan only makes sense if total medical spending will exceed the amount you will pay in premiums or you need or the need for specific treatments.
Medicaid was created as part of the Social Security Act in 1965. It was created to provide health coverage to the indigent population and to low-income people. The federal government sets guidelines, and within these, each state can decide how to implement Medicaid. This means that Medicaid will look different from state to state. The Children's Health Insurance Program was implemented in 1997. This provides insurance to children whose families do not qualify for Medicaid but cannot afford insurance. A major part of the Affordable Care Act is to expand the access to health insurance. One way the Affordable Care Act accomplishes this is through the expansion of Medicaid. To prepare for the expansion, the time from 2010 to the enacting of the expansion in 2014 was spent in preparation. Financial planning was one of the things they did to prepare. The federal government, to encourage states' participation, offered the states full funding for the first 3 years post-implementation, funding which decreases down to 90% in the year 2020. They also spent money to establish IT systems that would be able to handle the increase in patients. Another way they prepared is in the creation of the infrastructure to coordinate Medicaid and health insurance exchanges. In 2014, many states expanded their coverage of Medicaid to those who live below the federal poverty level of 138%, even if they have no children. To date, 32 states and Washington, D.C. have expanded, and there are others who are still considering. As of July, there was a 27% increase in Medicaid and CHIP enrollment. This graphic represents the populations who could possibly be enrolled in Medicaid pre- and post-implementation. Aside from the expansion of the CHIP and Medicaid program, there are two other ways that the ACA provides cost assistance for insurance premiums. One is the provision of tax credits. Tax credits allow U.S. citizens who do not qualify for government insurance or have workplace insurance to receive a credit on their taxes based on their income that will offset the cost of premiums. Cost-sharing subsidies help individuals and families between 138 and 400% of the federal poverty level limit the out-of-pocket expenses for premiums to percentage level of their income. The percentage the cost is limited is based on how much your income is above federal poverty level. The cost for the second tier civil level is then compared to this percentage. If the cost is higher, you get the difference as a credit towards any level of premium.
There is a drastic difference when it comes to the political debate of cost, quality, and access of ACA. Republicans believe that the law affects the physician-patient relationship negatively, reduces competition, and minimizes healthcare quality and choice, while the Democrats believe that the law affects the physician-patient relationship positively by allowing patients to have the ability to see a physician without fear of high rising costs. Republicans suggest that government-run universal health care leads to inefficiencies such as substandard care and long waiting periods, while Democrats are currently not even fighting for universal health care, just access to quality health care for those who are uninsured as well as underinsured. Republicans believe that the Affordable Care Act will economically damage the country, while Democrats believe that making health care available and more affordable to Americans will help heal the economy. Republicans state that the cost of the Affordable Care Act to businesses is too great and will cause them to cut hours or lay off employees in order to account for the greater cost. While Democrats believe that the cost to businesses is far more reasonable than the high cost to individual Americans would be without the act in place. Republicans believe not only in repealing the current administration's health care laws, but also in replacing them entirely with laws that will better serve the public. The Republican Party's greatest concern with the Affordable Care Act is the massive amount of money it would cost the American people to implement it and the risk this cost creates to small businesses in particular. While Democrats believe in not only expanding the current administration's health care laws, but also improving them to address gaps in access, affordability, and quality in health care. Expand and improve versus repeal and replace. In the Democratic plan, they plan to improve the affordability of the ACA premium tax credits, address unaffordable cost sharing, fix the family glitch, support enrollment assistance, and incentivize all states to expand Medicaid. While the Republicans' repeal and replace plan would be to expand health savings accounts, offer
refundable tax credits to subsidize the purposes of private health insurance and decrease dependence on employer-sponsored plans, cap the tax exclusion for employer-provided health insurance, allow people to purchase insurance across state lines, provide $25 billion in funding for high-risk pools over 10 years, devolve Medicaid to the states either through a block grant or per capita allotment, and partially privatize Medicare.
Although the Obama administration has somehow controlled the obstacles and challenges that are bothering state and national policymakers, however, there are some key challenges that the government needs to resolve in the first place to increase the effectiveness of ACA. The government kept Medicaid expansion as an option rather than a requirement, which has encouraged many states to not accept the expansion, and as a result, 4 million low-income people are unable to get insured under ACA. Government needs to make Medicaid expansion a requirement in order to reduce the resistance of state government and to fully benefit the low-income population of the United States. Obama administration has designed a cost-effective healthcare plan to work with major hospitals and healthcare associations to provide ACA's coverage to all low-income Americans. However, to implement ACA to its full potential, it is important to have access to affordable medicines or drugs. Unfortunately, pharmaceutical industries refuse to have any sort of changes in its pricing model because they believe that such a change would result in a drop in their profit margins. Obama administration needs to find an alternative way to reduce the prices of drugs and medicines to provide healthcare services to every American. It is important because this will enable the U.S. government to have an affordable polio vaccine or penicillin for the low-income group. The complexity of ACA is also affecting the successful implementation of this program throughout the United States. The changes in the financial condition, employment status, and personal health care can migrate a participant from Medicaid to health insurance exchange to federal government subsidized coverage. It can become a circle for a participant who move back and forth in these three programs with every change in the status. It will confuse or frustrate the participant and will encourage him or her to not claim the coverage. Moreover, the eligibility criteria of ACA for the immigrants is also not very clear due to the language differences, as it is currently available only in English and Spanish language. This is again making immigrants confused about the selection of a program as well as their eligibility status due to the lack of understanding and education and knowledge. The ACA has been criticized by many states and Republican governments, which is creating a political issue for the state and national policymakers. The ACA is considered costly for the state government, as well as it is perceived that the authority fully remains with federal government. Due to the high cost, resistance from the hospitals on state level, and demand for the transformation of entire political environment and rules and regulations are making it hard for around 27 states to accept ACA, and as a result, these states are developing their own healthcare program to eliminate the effect of ACA in the country. With the change in the government, the entire policies of a country experience a change. Therefore, the ACA's implementation and sovereignty is also in danger, as the arrival of new government could potentially implement major changes in this program. Moreover, there are a number of U.S. residents who are supporting the idea of universal health care plan, like the one that is implemented in Canada. The potential obstacles on state and national level to ACA could affect its practices and can encourage the new government to replace it with another one. It is also possible that the new government may increase or decrease the authority regarding healthcare on the level of states.
Is the ACA good or bad? Overall, the ACA is good for the American people. It has provided insurance to over 29 million people that was not previously insured. It strengthens the primary care system by providing coverage, freeing up tax dollars Americans use in the emergency room as their only form of health care. The elimination of preventing people with pre-existing medical conditions from having health insurance coverage. Expanding Medicaid to the underinsured and uninsured is also a plus because a lot of them will qualify for subsidies and tax credits. Creating mandates for implementation of EMR and providing wellness programs that promote prevention.